Hello, my name is Dr. Scott Young, and I'm here today with Emilee, and we're going to talk today about what happens when you call the audiology clinic for the first time. Coming right up. Okay, so Emilee, I want to talk to you a little bit about what happens when a patient calls up for the first time. What are some of the things, what are some of the nervousness issues that are happening with the patient? What kinds of things do you get into when you talk to them in the beginning?
Well, in the beginning, lots of patients have never been in for a hearing evaluation,
Right.
and they're curious about what goes on in the process.
Right.
So I explain what happens when you come in, who they'll be seeing, why they're wanting to come in. That's a big one, because lots of people have been noticing hearing loss for a while and haven't addressed it, and that can be a really scary thing for patients.
Right. So like when someone calls up and they've, there are statistics that they've waited maybe, 5, 6, 7, 10 years kind of thing. And when you kind of experience that, tell me a little bit about some of the fear that happens that you tend to hear over and over again with patients.
It's a new challenge. It's something new and frightening. Maybe they've tried hearing aids at one point in their life, or they've heard horror stories from people.
Right.
And that's scared them away. Or price-wise, there's so much information out there that they just really don't have any idea. I think a lot of it comes down to it's a change, it's something new, and that can be frightening for anyone.
Right.
So I get that a lot.
So what would you say is a little bit of the difference, what you do than what you might have thought that or you see other places do? Not necessarily, other audiology clinics, but other places when they're answering the phone. What do you think is the difference about what we try to do to help people on the phone?
Well, we want to help them. We want to help them hear. We want to get them in. I'm not just answering the phone like, oh, the phone's ringing.
Right.
I want to help them. I want to know why are you having this issue? Why are you calling me? Has it been a while, or are you not hearing your grandchildren's voices? I get that a lot.
Right.
Are you not hearing? Everyone's complaining that you're yelling at them and you're saying, huh, a lot. Like, we care why you're not hearing. That matters, and we want to help that. And a lot of other places just like, yep, hello, what you want?
See, and that's a powerful point. I mean, I don't hire people just because if they're just taking the number and moving on, scheduling the appointment, whatever, get off the phone kind of thing. See, I could never do her job because I'm not that good at that, because it's just like it would stress me out because there's so many things happening at the same time, and she knows I don't do that well with that, right?
That's what I'm for.
That's what she's here for, because she's got that different personality type to handle that. And that's why people do different jobs. I mean, I'm the owner of the clinic, but it doesn't mean I could go up and do her job for 1 or 2 patients, but I'm not going to do it day after day after day very well. So, that's the reality. You want to have someone like Emilee. And I've watched Emilee, I'll say this, I've watched her with literal chaos going on behind. She's entering something into the computer with a patient. The audiologist is in her ear over here. Another one's walking down the hallway. She can hear conversations, of patients walking out of a room, walking into a room. There's something going on down here. And even every once in a while we have, other crazier things that can happen like that, with like the power went off and, things that go on. And yet none of that stuff messes with her brain. She can still stay on topic.
Calm in the storm.
Yeah, calm in the storm, and I think that's a powerful point. And that's some of the issue that happens. So when you think about that patient coming in, you don't see him as a bother. Why don't you see him as a bother other than you want to help them? Is there any other thing that kind of is inside of you that says?
Well, yeah, of course. I know in times and places I've gone in somewhere and have needed help, and that's my personal issue. And if I'm afraid of something, or it's change, or it's something that's new for me, someone else can make all the difference in the world just by being that calm, like, no, you're not a bother. Like, we've had patients come in and be like, it's me again, you're bother, walking through the door with my problems again. And we're just like, no, No, that's why we're here.
Yeah.
We're here to help. We're the doctors. We're here to help.
Right. So if they don't come in, if you don't come in, you don't call Emilee, we don't know that there's an issue.
Right.
I mean, we can't guess that stuff too. So that's one of her jobs. There's a billion other jobs she's doing. She's doing marketing issues. She's doing interaction with other parts of patients. Excuse me. Insurance issues, which are another kind of bother. Unfortunately, that's a bother of a bad kind, necessarily.
Yes.
But that's actually what we spend a lot of time on. So I just wanted to give you kind of a quick overview of what Emilee kind of does. So if you like what we're talking about, ask questions down below. Happy to answer it. I mean, she and I will both be kind of on there answering that stuff. You can look at our Facebook. That's where she posts quite a bit on there as well. But lastly, subscribe. Tell your friends about it, because that's who we want to help. We want to help those people who are in the eastern Oklahoma area. So thank you so much for listening.